This is the Marquis and UNC 12 probe used when assessing the periodontal health of your patient. In this video, we will go over how to read each probe, how to use them with the proper technique, and the improper technique for using these instruments. The UNC 12 probe is 12 millimeters in length with marcations at every 1 millimeter. There are two distinct black bands beginning at 4 millimeters and at 9 millimeters. The Marquis probe differs in that it has distinct silver and black bands, each representing 3 millimeters. These bands range from 1 to 3, 4 to 6, 7 to 9, and 10 to 12 millimeters. To begin using the probe, grasp it along the knurling using your C-shaped grasp. Establish your fulcrum 1 to 2 teeth away. Gently insert the tip of the probe into the sulcus and walk it along the tooth surface by bobbing up and down without leaving the pocket. As you walk it across and you move into the interproximal area, ensure that you keep it angled along the long axis of the tooth. You can do this by rocking and rolling up and down on your fulcrum to change the angle of your probe. For posterior teeth, you will begin at the distal line angle, walk the probe into the contact area, and then walk it towards the mesial. Notice how the angle of the probe changes as you move into the interproximal space. This allows you to stay adapted to the long axis of the tooth and to angle under the contact of the teeth to access the caul, which is a depression which connects the gingival papilla situated between two teeth. Indirect vision should be used when accessing areas that you cannot see ergonomically with direct vision. Here is an example of probing a few teeth on the lower right. Use this as practice and try to determine what the pocket depths are as this instrument is advancing. When we are assessing pocket depth measurements, remember there are 6 sites that we are assessing. 3 of them will be on the facial or buccal, the other 3 will be on the lingual. On each side, you will have a distal measurement, a direct facial, buccal, or lingual measurement, and a mesial measurement. Next, let's look at some examples of incorrect technique when using the periodontal probe. Notice how the clinician is using a sweeping motion to move the probe across the sulcus. And here, the clinician is using fast spot probing and only checking the 3 sites. In both of these techniques, they are very likely to cause discomfort for the patient and miss narrow, deep pockets.